Come in.
Hi, Miss Sloth. My name is Samantha. I'm going to be your nurse today. Can you give me your name and date of birth?
Betty Sloth, January 8th, 1993.
Okay, and do you have any drug allergies that we're aware of?
No, I sure don't.
Okay, I'm going to wash my hands. Do you know what today is?
March 13th, 2022.
Okay, and do you know who the president is?
Biden.
Okay, and do you know why you're here today?
See the doctor for a
Okay.
checkup.
Okay, and let's see. So we're gonna do a full head to toe. So I'm gonna start with your head and move down.
Okay.
I'm gonna check your head. So we're gonna feel for any lumps, bumps, bruising. We're gonna look. So your hair is good and evenly distributed. There's no lumps or bruising. Head's good. We're gonna go ahead and I'm gonna check your ears. Ears are good. There's no redness or drainage. There's no swelling of the auricles. All right, and we're going to check your nose. Nose is good. Mucous membranes are pink and moist, and nasal septum is midline. Go ahead and open your mouth for me. Okay, mouth is good. Mucous membranes are pink. There's no signs of lesions, gum bleeds, or cyanosis of the lips. And I'm going to go ahead, I'm going to fill your throat real quick. So your trachea is midline. I'm going to take my two thumbs and press on either side to feel for your thyroid. Thyroid feels good. I'm going to check your lymph nodes real fast. So we're going to start with our pre-auricular, our post-auricular, our retropharyngeal, our occipital, our submandibular, our submental, our anterior clavicle, anterior clavicle chain, our posterior chain, our deep cervical, and our supraclavicular. And so all of those are good. They're non-palpable as well as your thyroid, so that's all normal findings. I'm also going to go ahead and I'm going to listen to your carotid arteries for bruits. So I'm going to start with my bell, and we're going to listen and listen. No bruits noted. We're going to listen with our diaphragm. That sounds good. And then I'm going to feel for your carotid artery one at a time and compare it to the apical heart rate. Okay, it's equal and equal. So that's what we want to hear. So there's no disparities there. And then I'm going to have you lean back at a 45-degree angle and turn your head. Look for jugular vein distension. Both sides look really good. There's no distension or anything noted, which is normal. Then we're going to go ahead and we are going to do your cranial nerve. So the first one we're going to test is cranial nerve 1. So I'm going to have you do 2 different smells. So we're going to check your nose. So can you go ahead and smell that side?
Peppermint.
Okay. And this side?
Lavender.
Perfect. And then we had our CNA check your vision beforehand, as well as your vital signs beforehand. So your vision was 20/20 on the Snellen chart, which is cervical nerve 2. Nope. Cranial nerve 2. And then your vital signs all came back normal. Blood pressure was 120, heart rate was 89, respiration 16, temperature was 97.8, and your O2 was 98. All that's normal. And then we're going to go ahead and we're going to check your eyes real quick. So I'm going to have you stare at the wall right over there. Okay, pupils are equal and reactive to light. We're going to check your 6 cardinal fields of gaze, which is your cranial nerve 3, 4, and 6. So I'm going to have you stare at my pen light. I'm going to move it slowly in all directions to check for nystagmus. Okay, none noted, and go ahead and stare at the wall. All right, and eyes are accommodating. Then we're going to go ahead and I'm going to check facial nerves 5 and 7, facial nerve which is 7. So we're going to take a cotton wisp and rub it on the face. Patient should be able to feel it. And then we're going to do our trigeminal nerve, which is cranial nerve 5. So I'm going to have you raise your eyebrows for me and puff out your cheeks and smile. All that was good and normal. You have a really great smile. And then we're going to do our whisper test, which is cranial nerve 8. I'm going to stand 2 feet away and whisper 1, 2,
1, 2, 3.
Okay. And over here,
ABC.
okay, good job. And then we're going to go ahead and check cranial nerves 9, 10, and 12. So I'm going to check your gag and swallow reflexes. So go ahead and open your mouth. Can you say ah for me? Ah. Uvula is midline and moves when the patient says ah. I'm going to go ahead and give you a sip of water. Can you swallow that? Patient can swallow. And then I'm going to check for gag reflex. Patient has positive gag reflex. Then we're going to go ahead and we are going to, have you stick your tongue out and move it side to side? Okay, perfect. Thank you. And then we're going to check your trapezius. So I'm going to put my hands on your shoulders like this with resistance. Go ahead and shrug. Good. And can you go ahead and do it again? Perfect. Patient has good movement there. So we're going to have patients, test for patient's gait and balance. You have patient walk back and forth. Patient has good gait. Then you're going to have patients walk for balance, heel to toe, back and forth. Balance is good. We're also going to check, we're going to do the Romberg test, which is also cranial nerve 8. We forgot. Patient will stand and you will watch for swaying. You're going to watch them for 20 seconds. Minimal swaying is okay, but you do not, excessive swaying would be a positive Romberg sign. Then we're going to go ahead and move over to our rapid finger movements, which is the upper motor neurons. So I'm going to have you do this. Good job. And then we're going to do heel to shin, up and down both sides. Good job. Patient can do those. And then we're going to move to our chest and arms. So we want to check, make sure everything looks good. There's no scarring, bruising, or edema noted in the arms or chest. And then we are going to check for range of motion. So we're going to have the patients put their arms up and down and out and in. Patient has good range of motion. I'm going to have you press against my hand. Good job. Press against my hand. Good job. So range of motion is good. Symmetry is good. Squeeze my fingers. Strength is good. And then we're going to check your thoracic cage expansion. So I'm going to have you take a big deep breath. Okay. The fingers should move symmetrically on either side. So that's good. Now we're going to do our deep tendon reflexes. So the first one we're going to do is our tricep. So we're going to come at the back of the elbow. Oh, that arm twisted. Back of the elbow with the pointy end. We're going to hit. Okay, good job. Our bicep, we're going to put our thumb over the bicep nerve and hit our thumb with the sharp end. Good job. And then we're going to do the brachioradialis, which is going to be 2 inches above the wrist. And you're going to hit with the flat end on the skin. Good job. And then we're going to do capillary refills. Capillary refills is less than 3 on all 10 fingers. We're going to move to our heart sounds. We're going to have the patient remove their shirt. So we're going to start on our apical with the bell. We're going to listen. It's going to be second intercostal space. Right sternal border. And we're going to listen here. Then we're going to move to our pulmonic, which is going to be the second intercostal space, left sternal border. So both of those, S1 or S2 is greater than S1. Then we're going to move to our third one, which is our Erb's point, which is going to be the third intercostal space, right sternal border. So S1 and S2 should be equal. On the next two, which is one is our tricuspid, which is going to be our fourth intercostal space, right sternal border, and that one, S1 is greater than S2, and our mitral valve, which is going to be our fifth intercostal space, mid-clavicular line, and S1 is greater than S2. And then we're gonna listen to all five with the bell of our stethoscope for bruits. No bruits noted. We're going to also listen to our apical heart rate for 1 full minute. Okay, and then we're going to go on to our breath sounds, looking at the patient. Breaths are equal and unlabored. We're going to start listening every time they touch, instruct them to take a breath. We're going to listen in a ladder pattern, so we're going to go side to side and down and listen. Okay, no advantageous breath sounds heard. We're going to go to the back, do the same thing. Okay, then we're going to go to our lateral breath sounds. So on the right side, we're going to listen to 3, because there's 3 lobes to the right lung. 3. And on the left side, we are going to listen to 2. Okay, so again, chest looks normal. We're going to check for our skin turgor. Skin turgor is normal. And then we're going to go ahead and move on to our abdomen. So you're going to have the patient lay flat. Okay. You're going to ask about bowel movements and urinary patterns. You're going to ask about consistency and frequency and any signs or symptoms of a UTI. So for our abdomen, we are going to look for any signs of herniation or ascites. The belly is rounded, and we're going to start auscultating in the right lower quadrant, up to the right upper quadrant, to the left upper quadrant, and to the right lower quadrant. We're also going to listen with the bell of our stethoscope to the aortic, the abdominal arteries, to listen for any bruits. Nothing's heard. And we're going to percuss on all 4 quadrants again. Okay, tympani should be heard. And then we're going to lightly palpate with 3 fingers in a circular motion, not dragging. All right, there shouldn't be any tenderness or swelling. So all of that has been taken care of. Now we're going to go ahead and check our lower extremities. So we're going to start with looking at them. Skin is normal. You need to check with the dorsal of your hands on all areas of the body for warmth. Legs are warm bilaterally. We're going to go ahead and check for range of motion. So you can have the patient lie down. We shouldn't have set you up yet. I'm sorry. So we can move up and out and down, up, out, down. That's good. Have the patient press against your hand, pressing down at the bottom, and have your put hand on top. Have patient press up. Strength is good in both feet. We want to go ahead and have them flex and extend their toes. So up, down, and then we're going to do our deep tendon reflexes again. Okay, so we're going to check the knee here with the point right below the patella. Done. Below the patella. Done. Again, we're going to check for any edema as we work our way down to the feet. There's no pitting or swelling. We're going to check the capillary refills on all 10 toes. They were all a +3. All pulses were a +2. And patient seems to be overall in good health. And then now